Great. Well, hello, everyone, and welcome to another live guest interview within the Mindful Journey. If this is your first time joining us, or if you've been with us for a number of guest interviews, certainly appreciate your participation and engagement. If you have any questions throughout, please feel free to put them in the chat function, and we'll try to get to them on the back end of the discussion. I'm so delighted to bring you our guest today, Dr. Anna Lembke. Dr. Lembke is a psychiatrist, professor, and medical director of addiction medicine at the Stanford University School of Medicine. She has been a program director of the Stanford Addiction Medicine Fellowship and chief of the Stanford Addiction Medicine Dual Diagnosis Clinic. She is a diplomate of the American Board of Psychiatry and Neurology, and also a diplomate of the American Board of Addiction Medicine. Dr. Lembke was one of the first in the medical community who had sounded the alarm on the overprescribing of opioids and the opioid epidemic. In fact, she had written a book called Drug Dealer MD, How Doctors Were Duped, Patients Got Hooked, and Why It's So Hard to Stop. If any of you are Netflix viewers, it's likely that you are probably familiar with Dr. Lembke, as she was featured in The Social Dilemma, which has now become a very popular and publicized documentary that Netflix had released about a year or so ago called, again, The Social Dilemma. And more recently, in August of 2021, she released the book Dopamine Nation, which I'm a huge fan of. Dr. Lembke certainly found many great pieces of wisdom in there. And I just love the humility in which it was written and the vulnerability that you shared from your personal life and your patients. So for any of you who've not read it, I highly recommend it. Dr. Lembke does a fascinating job of breaking down complex ideologies and scientific terms into easy to understand lingo that folks who may not have a background in medicine can understand. So with all that being said, Dr. Lembke, welcome and thank you so much for joining us.
Well, thank you. I'm excited to be here.
Great. Well, I know you probably get this question all the time because you are now an expert in the dopamine space. And I'd like to just start there. What is dopamine? Can you help us understand what it is and how it impacts our life?
Sure. So dopamine is a chemical that we make in our brains. It's a neurotransmitter, and neurotransmitters are the molecules that bridge that gap between neurons. That space is called the synapse. So neurons are the workhorse cell of the brain. They conduct electrical signals from one to the other to make the circuits that create our thoughts, emotions, consciousness, everything. But the neurons don't actually touch each other. There's a little space between them, and that's called the synapse. And that allows for fine-tuning the circuits, and the molecules that bridge that gap are called neurotransmitters. And dopamine is one of those neurotransmitters. And it is expressed in different parts of the brain, but one of the most important places where dopamine is expressed is a specific circuit called the reward circuit, which consists of deep midbrain structures like the nucleus accumbens and the ventral tegmental area, communicating through long circuits and synapses and axons and dendrites to the prefrontal cortex, which is that gray matter area right behind our forehead, and that's called the reward circuitry. So what happens is when we do something that's positive or reinforcing, dopamine gets released in that particular reward circuit. And that is what gives us that feeling of pleasure that makes us motivated to do it again. So that's essentially dopamine. Dopamine is also, as it turns out, really important for movement. It's released in another important part of the brain called the substantia nigra. And for example, when dopamine gets depleted or goes down below healthy levels in the substantia nigra, that's what causes Parkinson's disease. So it's no coincidence that dopamine is involved both in motivation, pleasure, reward, and in movement, because for most of human existence, those things were intertwined. If you wanted your reward, you had to get up and move to go get it. But today, that's no longer really true. And that's part of I think the modern struggle.
So is there a difference in how dopamine is transmitted in our reward pathway if we're engaged in a task that's potentially viewed as harmful, like overindulgence in social media or cigarettes or drugs, whatever it may be, versus something that may be potentially viewed as helpful, like for our cardiovascular health, like exercise or running? Because I know when I run, I get admittedly, I don't always feel like running, but I get this feeling of, first of all, I do some of my most creative thinking. And then when I'm done running, I just feel like accomplished. I'm assuming dopamine is what's contributing to that feeling. So all that being said, is there a difference in the pathways that it's going through and the abundance of or lack of when we're engaged in something harmful versus something that is helpful?
Well, it sounds like what you're getting at is whether we're getting our dopamine, quickly and in large spikes by using an intoxicant or something that gives us immediate pleasure, versus where we're paying for our dopamine upfront by doing something that's effortful or even physically painful, like exercise, in which case we actually don't get dopamine right away. We get dopamine as an opponent process mechanism or as a response to cellular injury. So, so starting on the pleasure side, and I use this extended metaphor of the balance in my book, A Pleasure Pain
Yes,
Balance.
love that.
Yeah, like a teeter-totter at a kid's playground. And that essentially represents how we process pleasure and pain. Some of the most interesting findings in neuroscience in the last 100 years is that pleasure and pain are co-located. So the same parts of the brain that process pleasure also process pain, and they work like opposite sides of a balance. So what happens when we do something that's immediately reinforcing, like ingest an intoxicant, like play, and I use the term drugs very broadly to include behaviors like gambling, sex, video games, social media, and substances, cannabis, opioids, cocaine, alcohol, nicotine. Those substances, what they do is they immediately press our pleasure pain balance to the side of pleasure, and they do it very quickly and with a kind of a huge deviation from neutrality. So they're potent intoxicants, and they release a lot of dopamine all at once in the brain's reward pathway. That's sort of the signature of something that's potentially addictive. It releases more dopamine than modest rewards, and it releases them quickly. Although intoxicants work by different pathways, some through the endogenous opioid system, some through the endogenous serotonin system or the cannabinoid system, the final common pathway of all reinforcing drugs and behaviors is dopamine. So we get the sudden release of dopamine in the reward pathway. It feels good, but one of the overarching rules governing this pleasure-pain balance is that it wants to remain level or return to what neuroscientists call that homeostatic balance or homeostasis. And the way the brain does that is first by tilting an equal and opposite amount to the side of pain. That's the after effect, the come down, the hangover. I like to imagine that as these little gremlins that represent neuroadaptation that hop on the pain side of the balance to bring it level again, but they like it there, so they stay on until the balance is tipped an equal and opposite amount to the side of pain. Then they get off, right? And then balance is restored. So that's just sort of the universal law of how we process pleasure and pain. For every pleasure, there's a price. There is a come down. It might be subtle. It might be outside of conscious awareness. It might manifest as when we come to the end of a video, and it says that little button comes up that said next episode. We have this overwhelming urge to press next episode, even though we told ourselves, well, I just want to watch more.
Right.
That's because we're in that come down phase. Those gremlins are on the pain side of the balance. And so we naturally, in that state of pain, want to reach for more of our drug in order to restore homeostasis and possibly even get back to that pleasure side. What happens as we could become addicted is that with repeated, this is the second rule of the balance. So the first rule is the balance wants to preserve neutrality and does it first by tilting an equal and opposite amount to the other side before going back to level. The second rule governing the balance is that with repeated exposure to the same or similar pleasurable stimulus, that initial deviation or the spike of dopamine gets weaker and shorter, but that after effect or the come down gets stronger and longer. In other words, to accumulate more and more gremlins on the pain side of the balance. And that means that over time, we need more and more of our drug to get the same effect. But also, ultimately, what happens is the balance kind of gets stuck on the pain side. So the gremlins are now camped out there so that even if we're not using for a day or a week, the gremlins are still there because we've essentially changed our hedonic or reward set point, which is why people will relapse even if they haven't been using for a month, or even longer in some cases. It's because they're walking around with their balance tilted to the side of pain. Now they need to use just to feel normal. And when they're not using, they're experiencing universal symptoms of withdrawal from any addictive substance, which are anxiety, irritability, insomnia, dysphoria, and craving. What we know is that with enough sustained abstinence from our drug of choice, those neuroadaptation gremlins eventually hop off the pain side of the balance. It can take a while, and homeostasis is restored, and we're back to our neutral position. Then we can use a little bit of our drug and it can potentially feel good, although the gremlins really remember, so they will hop on. But more importantly, we can use more modest, we can engage in other more modest rewards, and they're reinforcing. We no longer have that narrow focus and preoccupation on our drug of choice. So this is all by way of saying that whatever that initial stimulus is, the gremlins hop on the opposite side. So when you talk about exercise, what you're essentially doing is you are pressing initially on the pain side of the balance, okay? Exercise is actually toxic to human cells. Why?
Interesting.
And how on earth is it good for us?
Right.
Right. Because of something called the science of hormesis. And hormesis is a whole branch of science. Hormesis is Greek for to set in motion. And there's a whole area of science, and there's animal studies and human studies showing that when we expose ourselves to mild to moderate amounts of toxic stimuli, things that are bad for us, like things like exercise, or extremes of temperature, or starvation for periods of time, intermittent fasting, which is painful for our bodies. The reason that it's good for us is because it's a signal to the body to start to heal by upregulating our own feel-good neurotransmitters like dopamine, norepinephrine, serotonin, our endogenous opioids, our endogenous cannabinoids. Because what happens is when we press on the pain side of the balance, remember, the overriding physiologic drive is to restore and preserve homeostasis. So then the gremlins hop on the pain side of the balance to bring it level again, but they don't hop off when the balance is level. They stay on until we're tilted an equal and opposite amount to the side of pleasure. And that's where you get your dopamine when you exercise. So initially, you probably don't feel that good. Certainly before exercising, most people
Right. Exactly.
Start out, it's like, But at some point, they will reach a point, or maybe it has to be when they're actually done exercising, depends on the person, where they get basically a flood of endogenous opioids, endorphins, cannabinoids, serotonin, norepinephrine, dopamine. And what's really interesting about, pressing on the pain side of the balance is that it's much more sustained amount. So if you chart a graph of dopamine release during exercise, it's a gradual increase over the course of the exercise. And then dopamine levels remain elevated for hours afterwards before going back down to baseline. So we all have a tonic baseline level of dopamine firing. Now contrast that to an intoxicant where you get a sudden flooding in your brain of dopamine, right? Boop. But then it goes into dopamine free fall, not just to baseline, below baseline, the gremlins on the pain side of the balance. Then we're in withdrawal and craving. You want to have another episode, another piece of cake, another joint, another glass of wine, whatever it is. So we have to essentially pay for our dopamine afterwards with this dopamine deficit state, in contrast to doing things that are painful, where we pay up front. So you pay up front with you put the pain in first, and then you get the sustained dopamine afterwards.
That was eloquently and beautifully shared, and it was the same in your book. That how you conceptualized and really brought together this pain pleasure principle, if you will, has been truly fascinating. And I love the gremlin visual because you share it in the book, and I tend to be more of a visual learner, so being able to see it in the book helped me understand how the overindulgence or engagement with the social media, with the whatever it is, the addiction can really impact. So I'm curious, you mentioned the tonic baseline that we have. I'm curious as to if I'm engaged in cigarettes or whatever the drug of choice is for an overextended time, knowing that I want to get off, how long do I have to disengage before that pain comes back down to an equilibrium wherein I can feel less inclined to want to go back to it? Or is there a time frame? Does it vary by person?
So on average, the average person needs to abstain for a minimum of 30 days to be able to reset reward pathways. And for people who have been using their substance for a long time and are more severely addicted, that's really like the bare minimum, where they start to feel better and there's this hope that there's light at the end of the tunnel and they won't have to be in abject misery. And typically, it usually takes more like 3 to 6 to 9 months, and in some cases, even 18 to 24 months for true homeostasis and healing to occur. And even once that has happened for people with severe addiction, they're always going to be vulnerable because the brain is probably permanently changed from that addictive experience, which explains, plus the underlying innate vulnerability that we come to the table with, which is different between people, and it's genetic and inborn, much of it. Which means that person is always going to be vulnerable to addiction to that drug or behavior, such that even after sustained abstinence, if they indulge again, they might be, put right back into the midst of their addiction. That's not true for everybody. Some people, after a period of abstinence, a minority of people, a small minority, have been able to go back to using in moderation. But oftentimes they'll say to me, it's not worth the effort. Like, it's so effortful to moderate that, they choose abstinence in the end because it's just easier to do. I would say for the average, compulsive overconsumer of like digital content, which is almost all of us now, I always recommend, if you feel like that's adversely impacting your life, or if you wonder if it is, the thing to do is to try to give it up for 30 days. Know that in the first 2 weeks, you're going to feel bad because you're going to be installed. The gremlins are going to be, but if you just wait and hang in there, just imagine those gremlins slowly hopping off the balance and balance ultimately being restored. And what you'll notice, because I've done the experiment many times in my own life, is that come week 3 or 4, you're not as mentally preoccupied with using. It doesn't have that same pull. It doesn't have the same, what we call salience, like where it feels so important where it did before. It's so interesting when people get to 30 days and they like look back at their using self, and it seems surreal because that person put so much energy toward the drug. And then people start to know just improvements in mood and anxiety and sleep and attention and ability to be present. So I think it's a good exercise, even if you don't think you're addicted or you're not having serious consequences. I mean, people have been doing this for centuries, under the religious practices, and now we do it sort of in social media, dry January or whatever it is. But really what's happening physiologically is that we are resetting reward pathways, getting those gremlins off the pain side of the balance, restoring motivation and reward homeostasis, which allows us to better perceive the true impact of our drug use on our lives. And I use that term drug very broadly.
Sure.
It also allows us potentially to be able to then go back to using in more moderation because we've lost the tolerance and we're going to be more sensitive.
Fascinating and quite interesting. Social media obviously plays a big role in my life, and admittedly, there are times where I'm scrolling through and I'm like, I just spent 20 minutes unconscious and unaware of how it has sucked me in. So I've certainly done a number of times where I've kind of disengaged for just a week. I've not tried a full 30 days, but this is probably a good inspiration to disengage for 30 days. So you mentioned, going back to your book, you mentioned that depression from 1990, I think, to 2017, rates have increased worldwide 50%, if I'm not mistaken. And there was a profound statement in a separate portion of the book that kind of ties together, that hit me like a ton of bricks. You said that the reason we're all so miserable now is because we're trying so hard to avoid being miserable. Why do you think now more than ever people are seemingly more depressed and wanting to avoid life?
Well, okay, so let me see if I can tease that apart a little bit. First of all, I mean, the major hypothesis in the book is that because we're living in this time of nearly infinite access to highly reinforcing drugs and behaviors at the touch of a fingertip, we've all essentially put ourselves into this chronic dopamine deficit state, which means now we need to keep using, not to feel good or get pleasure, but just to restore the balance and feel normal. And when we're not using, we're experiencing those universal symptoms of withdrawal, which include anxiety and depression. So I hypothesize that the rising rates of depression and anxiety, all over the world, especially in rich nations. So if you look at like happiness quotients or happiness surveys or rates of suicide, it's clearly increased over the last 3-4 decades. And it's clearly linked to socioeconomic advantage. Richer countries, people are more unhappy, they're more depressed, they're more anxious, they're more likely to take their own lives, they're more likely to struggle with addiction. And of course, there are many possible reasons for that. It's never going to be just one thing. People talk about, social dislocation, childhood trauma, poverty, all of these things. But what I contend is that a major factor is just the way we're bombarding ourselves with dopamine and thereby really changing our brain physiology such that we literally aren't able to experience pleasure because we're experiencing and chasing so much pleasure. And we're really very much more sensitive to pain because we're so insulated for pain. And so it's a physiologic recalibration that we're struggling with. Hence, the answer to that is not necessarily to, explore your early childhood in psychotherapy, or to, do other types of interventions, take medications or whatever. The real intervention might just be to get rid of all the pleasure in your life and intentionally do things that are hard. And that's essentially what I end up prescribing, at the sort of the culmination of the book. So I don't know. So I don't really see it so much as like we're, I think it's a basic human need to want to not be in our own heads for a while, right? Like not think your thoughts.
Yeah.
Right. I mean, we all have that. I mean, most of us, have that desire, like let me just turn off my brain for a while.
Sure.
And we can do that when we sleep, but even sleep, we fight and resist and we don't get enough of it because I think we're in this hyperstimulated world. We're chronically overstimulated. We're chronically over dopaminized. And we don't see that that's actually what's driving the psychological and physical distress. And that really what we need to do is embrace a kind of new asceticism, create barriers between ourselves and all of these hyper convenient, easy pleasures, and intentionally make our lives more difficult, insert more friction into our experience, live more in our bodies, do things that are going to connect us to our bodies that's not using drugs. I think one of the reasons drugs are so appealing is it's one of the rare avenues in which people can have a physical experience and be in their bodies because we're spending so much time sitting in our chairs. So I think that's sort of, my messaging. Unfortunately, what's happened is that the cultural narrative has also transformed to encourage people to be afraid of pain, to say, well, if you have a trauma, that's bad because you're going to have post-traumatic stress disorder. But really, there are certain types of healthy and adaptive stressors that make us more resilient, that serve as a kind of touchstone for future difficulties and challenges where we can look back and say, well, I survived that other thing. I'm strong enough to survive this. So it's also the stories that we tell about, our lives that impact how we navigate the modern world.
Yeah, I love there's certainly power in stories. And so many times we tell ourselves disempowering stories. And I trust and suspect that can lead to engagement with some form of drug use because we don't feel enough. We don't feel like we have worth or value. And going back to your point of wanting to escape, although we all feel that need to disconnect, sometimes people's wanting to disconnect is an escape from wanting to face the realities of what's now. And that kind of brings me to another thought from your book as it relates to facing what is now. I loved you devoted a whole chapter to radical honesty. And that also made a tremendous impact on me and challenged me to be introspective because I became aware through that there have been subtle lies that I've accepted in my life. For example, I pride myself on being on time when I have something important to do, right? But there are many occurrences where I'm going to meet a friend for dinner, and instead of saying I'm 25 minutes away, I say I'm 5 minutes away. And it's just kind of like one of those things that I know I'm not going to be there in 5 minutes, yet
Yeah.
I say I'm be there in 5 minutes, and I'm really 10 or 15 more away. So I say all that to say or ask, why is it that radical honesty is so important in the healing process and the getting through addiction process? And would you also mind sharing with the viewers and listeners that story about the gentleman who you treated, who was I believe, a doctor, a practicing physician, who ended up having to take the stand for a DUI?
Yeah. Okay, great. Yeah. Well, first of all, thank you for sharing that wonderful example. It's a perfect example because it speaks to like just all the subtle little lies that we're all, guilty of,
Yep.
unless we're really effortfully paying attention and trying to change that behavior. There are studies showing that the average adult tells 1 to 2 lies per day. So it's very common for us to lie. And typically the types of lies that we engage in that we don't even register are the little lies that make us look a little bit better, make us seem a little more interesting, cover up our little acts of selfishness and disorganization and procrastination or whatever it is. So I love your lie because, first of all, I love how you started to say you pride yourself on being on time. And that's a good thing to be on time, because what it says is that it says to the person you're meeting, I respect you and your time, and I don't consider my time to be more valuable than yours. I consider us to have equal value on time, which is our most precious commodity.
Love that. Oh, I love that.
Yeah. So, but then on the other hand, when we're late, what we're essentially saying is, I'm more important than you, and my time is more important than you. So first of all, it's very good that you recognize that being on time is a virtue, and you try to be on time. But when you're not, totally fascinating that you are able to, maybe after reading my book, I don't know, observe yourself telling this lie where you're not lying about being late, but you're lying about how much you're going to be late by. And that's so interesting, because essentially what it is it's a way of you not just lying to that person, but really mostly lying to yourself.
Yes.
To say, I messed up a little bit.
Yes.
I only messed up 5 minutes worth. I didn't mess up 25 minutes. And, give or take 5 minutes, like that's cool. 25 minutes, that's pretty close to half an hour. Now, right? So that's exactly how we lie, right? We do these little, just a little bit. To one of the things that I often find myself pulled to lie about, related to this quantification thing, which is so interesting, is I'll be recounting a story to somebody, and let's say I was kept waiting for 5 minutes. Okay, this is like, and when I recount the story, I won't say, and I was really, let's say I was really pissed, right? I was and I was really pissed off. But now I'm telling the story to someone else, and like, to be really pissed off after waiting 5 minutes, that doesn't make me look very good, right? So then I might say I was waiting for half an hour.
Yeah.
And it wasn't half an hour, right?
Yeah, so true.
So, it's just, I love this, because all these little sort of the ways that we massage reality, to make ourselves look better, more virtuous, more interesting, more victimized, more put upon, whatever it is that we want to project in the world, whatever our identity is tied to. Like, your identity is probably tied to being like really upstanding and reliable. So for you, it's very threatening, to be like, yeah, I'm not that reliable. I can be half an hour late. So the point, okay, so now getting back to what you were originally asking, I love that story. I'm going to use that. That's so good. So what's happening, when we lie? We're essentially, we're lying to others. So we're losing that credibility. We're eroding intimacy, because eventually our lies catch up to us and people know we're liars. And then they don't trust us, and that erodes intimacy. Intimacy is an important, healthy, and adaptive source of dopamine. So when we erode intimacy, we further eliminate our healthy and adaptive sources of dopamine, and then are sort of chasing this dopamine that's ultimately gets us into this vortex of addiction. And so it's really, And the other thing that happens when we lie is that we're not then telling truthful stories about ourselves, right? Because stories that we tell are not just a way to sort of understand ourselves and our behavior, they also provide a very important roadmap for the future. Because if we're not telling true stories, we're really not looking at all the data. And you can imagine if you did a scientific experiment and you just like left out a third of the data, your conclusions based on your analysis of the data probably won't be right. And that's exactly what happens, when we lie. And really, I learned about the value of what I call in the book radical honesty, which is telling the truth about everything. So waking up and saying, I'm going to try to be totally truthful down to like exactly how many minutes late I was, or how many minutes late that person was that I had to. The pull on that is enormous. Like me wanting to exaggerate stories for effect, often for me to be seen as victimized in some way, which is really, really weird, because I kind of am like, well, we shouldn't play the victim, but I often want to portray myself that way, which is a fascinating idea. Haven't fully explored it.
That's the next book.
Right. Who knows?
Examining your
the next psychotherapy hour. I don't know. The next walk with my husband. Who knows? But the key is to wake up and say, you know what, I'm going to really focus hard on doing my best to not make any of those lies. And what is the result of that? Well, first of all, it's effortful. And probably it's activating the prefrontal cortex. The prefrontal cortex is that gray matter area behind the brain, which is so important for storytelling, delayed gratification, appreciating future consequences. Neuroimaging brain studies show that when people engage in short-term rewards, where they're going to get like a candy right now, areas of the brain that light up are the lizard brain. These are the older, phylogenetically conserved, reward pathway, pleasure, pain, balance, limbic structures of the brain. When people are engaging in a task that involves delayed rewards, so rewards that they're going to get months or years in advance, the prefrontal cortex lights up, right? So that's the part of the brain that's so important for this future planning phenomenon. So what happens when we intentionally try to go through the day and not lie at all, which is not our nature, we probably activate the prefrontal cortex because it's effortful. And by doing that, we're strengthening the prefrontal cortex, because whatever parts of the brain we use more actively, those are the ones we strengthen. And in strengthening that prefrontal cortex, we're allowing ourselves to keep an eye on and control the gremlins and not let the gremlins, run away and drive the bus. Because what happens in addiction is basically the prefrontal cortex goes dormant and those lizard brain structures rule the day. So we have
interesting.
Back online. Yeah. And interestingly, a TMS, so this is a transcranial magnetic stimulation, they have a paradigm for trying to use TMS to treat addiction. The paradigm is essentially to use the magnet to stimulate the prefrontal cortex and quiet down those deeper limbic structures, which is exactly, but we can do that behaviorally without TMS by intentionally doing things that are hard, and by intentionally embracing, radical honesty. But also just in terms of our autobiographical narratives, until we tell people what we're really doing, we don't really see it ourselves. And until we see it ourselves, we cannot incorporate it into our, self-narrative. And then we don't have access to the data to make future decisions. So those are just two really important reasons for radical honesty, or at least experimenting with it. In terms of the story that I talk about in the book, which is, I was so riveted by this young man who came to see me because he had gotten a DUI. He's a physician. He'd gotten a DUI years before, and he was getting new privileges, here at Stanford Hospital. And as part of that, he had to report the remote DUI. It was way in the past, but since he was in a new position, he always had to report it again. Anyway, I usually when I see faculty, who are struggling with the DUI, it's recent, but his was like decades ago. So he came and he told me the story, and the story was so fascinating. He was somebody with parents who had struggled with addiction. He himself, although having this genetic load, never developed addiction. And I think one of the reasons is because when he had an early experience with the DUI and drinking too much, and he was stopped by police and he got a lawyer, and the lawyer's like, whatever you do, when you get up on the stand, just say not guilty. Just say not guilty, no matter what, say not guilty. So he goes and he dresses up in his suit and he's like, okay, I know what to say. He gets up on the stand, his lawyer's like, remember, not guilty. And the judge says, how do you plead? And all of a sudden, he has like this time warp experience where he remembers his dad telling him, whatever you do, tell the truth. In life. He recounts like when he lied about having had lunch at a friend's house or something. I can't remember the exact anecdote.
Yeah.
And his dad found out that he lied, and his dad said, lying just really messes up your life. If you don't pay now, you'll pay later. He was on the stand and he recalls that, and all of a sudden the words that come out of his mouth are, he says, guilty. And his lawyer's like, no.
And the judge, in fact, the judge even said, are you sure, right?
Right, the judge, he did a double take, right? Like that, right? Yeah. Like, are you sure that you want to plead that way? He was in medical school, right? He pleads guilty, pleads guilty to DUI. And there were huge immediate consequences for him. He had to, he had to go to like DUI school for like the next 10 years. He had to, every time he applied anywhere, he said, I got a DUI and I was guilty. I mean, it just followed him. But in a really fascinating way, what he said is, I think that pivotal moment of telling the truth changed the trajectory of my life, because it didn't, I couldn't delay and avoid the consequences of my drinking. I got it all in one huge bolus at once. And there were times he regretted it, because it's still, when you're a physician and you have something like that, it's like a ball and chain. You can never, but for him, it was like this profound moment of, living in accordance with his values and finding that ultimately in the very long run, it was very positive for him. Now, one of the caveats there, as I said, this was a young white male, from a privileged background. So, this is in the context of he's in a criminal justice system that's gonna give him the benefit of the doubt. So, it's not that telling the truth in every single circumstance is the right thing to do. And in this regard, I differ with Kant. Kant has this, and Kant, the philosopher, has this very famous, he used to say, you should tell the truth no matter what. And I think there's like some anecdote, well, what if somebody's in your house hiding from people who are going to kill them, and the people come and that this person's hiding, like, what do you say? And Kant's like, yeah, you tell them that they're hiding in the closet. I'm like, no, you don't.
No, you don't. Yeah, no, I am not Dr. Lembke. I'm not going to tell the truth in that occurrence.
Right, yeah. So, but the lies to look out for are the ones that we tell almost unconsciously, that we do to cover up our own foibles, right? Because those are the ones we're really, doing a lot.
Yeah, well, like I said, your book, truthfully, it challenged me to be super in tune with I began examining, okay, what things have I accepted in my life that are actually lies that I have not even been conscious of. So kudos to you and credit to you for this book, for doing that for me. I will not tell the truth though if somebody's in my house trying to get to me or my family. So that's it was a fascinating story, and I'm grateful that you shared that from this gentleman who was or is a doctor at Stanford, because really in that moment it would have been easy for someone like him, who was a high achiever from society standards, who was set up and destined for quote unquote success, to just go ahead and accept the fact that his privilege, if you will, and he was going to be let off. And it made me think, if he can tell the truth in that sequence, in that scenario, I certainly should be able to tell the truth and how late I'm going to be. So thank you for sharing that. I know I want to be conscious of our time, of course. So I just are you okay still for just a few more minutes?
Yeah.
Okay, wonderful. So I wanted to back up a little bit. We got onto the honesty piece, because you mentioned, we talked a lot about just some of the addiction and how we're maybe avoiding right now through engaging like with social media, etc. And there's so much good information out there and so much research out there. And in fact, I think you mentioned in the book that 70% of, and I do have it written down, so I want to make sure I get it right, 70% of world global deaths are attributed to modifiable behavioral risk factors like smoking, physical activity, etc. Yet we have all this information and we know this, and there are still people who don't change. So my question to you, and it's a broad one, of course, but how do we get people to welcome change? The people who get off work at 5, who go right to the gas station to pick up a 6-pack of beer, and then go home and watch TV for the rest of the night and complain about the world. How do we reach those people who aren't aware of their habits, even though deep down inside they know that it's contributing to a lack of productivity and pain?
Yeah, I mean, so I think that neuroscience informed education is one way to get there. I feel like if people really understood that inactivity, smoking, the consumption of, processed foods. I mean, we're living in a world now where we have more people who are obese than who are underweight. That has never happened in the history of human existence before. So if we had people who really understood what was going on in the brain and why it is that that kind of life ultimately makes them more unhappy, and we tell them the specific behaviors that they can do, that's a first step. Then the second step is to recognize that you can't wait till the end of a long workday when you're tired and you have all these default automatic habits and behaviors to then decide to go on a walk instead, or decide to go to the gym. Our brains don't work like that. Once we're in the throes of desire, there's no deciding. We are caught up in that. We're animals. So we have to really anticipate that moment and create a framework that anticipates that moment of desire, so that way before, that moment, we make another choice. We make another choice and we plan that choice, right? So we use our frontal lobe and we plan that choice. So we don't get to the end of the day, should I go to the gym today? Nah, I'm not going to the gym. The night before, or maybe even the week before, we get our gym bag out, right? We tell a friend to meet us at the gym or at the park. You write it down, right? So you use your prefrontal cortex and you plan it out. And it's amazing when we do that, we're really kind of like sheeps to our own, our own schedules. When we create a schedule in advance, we will populate it. We really will. We're like, what am I doing now? Oh, I am going to the gym.
Yeah, sure.
Yeah. So, and then it's a matter of sustaining that new behavior long enough that it essentially becomes habit. So often, like, I'll wake up in the morning, I'm like, wait, what am I doing now? And it's like, oh, even on the weekend, what am I doing now? I don't know what to do first. You know what? I guess I'll just do my yoga routine, because that's what I do every other morning. It's 15 minutes long, but sometimes it's just, I can't think of anything else. So I do that first. And then once I've done that, it's like, okay, I feel a little bit better, actually. I'm going to go on a walk. All right. And when I come home from my walk, and I try not to look at my computer, for example, until those things are done. And then that just becomes my default.
Oh, I love that example. That's perfect. So for someone who is hearing this, who might be listening right now and saying, okay, well, I know I want to go to the gym. I'm going to try to pack my clothes at the end of the night thing. But after a week, or kind of like, well, I want to go back to drinking beer. What can they do? What can they do when that negative thought comes up that wants to, and maybe it's the gremlin that's, like you mentioned before, that's, although it's pleasurable, it's really bringing long-term pain. What can they do after that? Just continue with the consistent habit, or is there something else that you would recommend?
So, first of all, I think it's important to, again, to have some compassion for ourselves and recognize that we have a very vivid memory for whatever the initial stimulus is, whether it's pleasure or pain, but we're very amnestic when it comes to the gremlins. So we tend not to remember them. So I have a lot of patients who tell me they get this vivid euphoric recall for their drug, and that is what then pulls them to use again. What's much harder for them to access is all the downstream effects that happen. So part of what we work on is what's called thinking through the drink. It's a great AA term, think through the drink, where yes, when you get that euphoric recall, force yourself to either stop and write down or tell somebody all the bad things that happen when you drink. Sometimes people will even carry a little list, in there, a reminder, all the bad things. Likewise, the other thing that we can do when we get into that craving, to do our drug and we don't want to do it, sometimes we think, well, I'll substitute another pleasurable, but that often doesn't work that well, because then we can get cross addicted to that other thing. So instead, we can paradox ourselves and do the opposite and do something that's intentionally painful or hard. Sit down and do 50 push-ups, or sit-ups, immerse ourselves in an ice cold water bath. So when we're feeling low and down and craving and, hungover or whatever it is, to do the opposite and actually do something that's hard as a way to press on the pain side and reach reward pathways. Or, when I wake up in the morning and I'm thinking to myself, I should really exercise, I have to remind myself that I'm amnestic for the positive benefits of that. All I can think of in that moment is how I don't want to get out of bed and I don't want to exercise. But if I can think through that and remember the gremlins going on, then I can, okay, wait a minute. No, I do want to exercise, because although it's painful, I get all these positive downstream effects. Likewise, I have patients who will carry around in their wallet the list of all the reasons why they don't want to use.
That's powerful.
Yeah, right. Like for my family, so I can be more present for my kid, because it helps me not procrastinate, because it's consistent with my values. I like and respect myself more when I do X, Y, and Z. And you just pull it out and read it. So little tricks like that.
Yes, wonderful. Thank you for sharing that advice. I think that's perfect. Well, one of the questions I ask of every guest within the mindful journey is intentional by nature, because I believe that so many of us, especially in this hyper social media world, are constantly in comparison mode. And one of my favorite quotes of all time is that comparison is the thief of joy. And sadly, I've seen so many friends of mine and complete strangers that I've talked to too, who will get depressed after social media usage, not just because of the consumption, but because of the belief that everyone has the perfect life. That our neighbors have the perfect spouse, the perfect car, the perfect house. And I'm setting this up to ultimately ask you the question, because I believe one of the things I know that's helped me in my own life is recognizing that we're also human, and humanizing this experience that we're all on, for understanding that everyone's got something going on here, and everyone has been challenged, no matter how quote unquote successful. All of that to say, Dr. Lembke, and to your level of comfort, of course, what's the most challenging thing that you've gone through in your life? Perhaps maybe the romance novel addiction you speak to, or something else that you feel comfortable sharing. And what do you recall having done to get through your most challenging time?
Well, that's a big question. Honestly, the most challenging thing I've ever faced was the death of our child. And for me, actually, it was a spiritual pathway that ultimately was what helped me the most in that situation. And also gave me a lot of interest in spiritual healing in general, and a lot of interest and affinity for addiction recovery, because, spiritual awakenings are such a big part of so many people's recovery. I didn't write about that per se, in Dopamine Nation. It's sort of interwoven here and there, and I might write about it in the future, but it's sort of implied here and there. But that's sort of my thing.
Thank you so much for sharing. And if you could feel comfortable continuing the spiritual path, when you talked about that, was it religious? Was it prayer? Was it meditation? Was it an abundance of all of it combined, or what did that look like for you?
Yeah, it's kind of a potpourri.
Okay. Great. And lastly, and we can close on this unless there are any questions that come in. If there's anyone who's listening today who has a feeling of hopelessness in their own life, or facing any sort of adversity or challenge, what is your message to them to keep going?
Well, first of all, just conveying a message of hope, that we're so much stronger than we think we are, and more resilient, and we can overcome. And I think, your point about just recognizing that we're all broken and flawed, and suffer, that we're not alone in our suffering, and that our suffering can bind us together and take the sting away from it, and help us endure.
Thank you. That's wonderful. I appreciate your time so very much. You were a wonderful guest. You gave us much wisdom, many insights, and so grateful for you, Dr. Lembke. Appreciate what it is that you're doing in this world.
Thank you. You too. My pleasure.
Okay. All right. Have a great day. Take care. Bye.